As we continue our NHS Scotland Alliance Live special, I'd like to welcome our next guest, Catherine Ross, Scotland's Chief Healthcare Science Officer. Hi, Catherine, welcome and thank you for taking time to join us today. Please, can I start by asking you how you are?
Tommy, I am fantastic today. I'm feeling much better, but really, really good to meet you and really good to have the opportunity to chat with you today. So how are you?
Yeah, I'm doing good. Yeah, and really looking forward to our conversation today. And for anyone listening, to visit stand 60 at the NHS Scotland Conference, and you can meet the team in person as well. Catherine, please might I start by asking, can you explain to us a bit more about your role at the Scottish Government as the Chief Healthcare Science Officer, and what does this mean?
So thank you, Tommy, actually, because I'm really keen to tell you a little bit about more what I do and also what healthcare scientists do. So as Chief Healthcare Science Officer within Scottish Government, I have a number of sort of key roles. So policy development across all elements of impacted services by the scientific workforce within the NHS in Scotland. So that could be education, clinical services, workforce research. And really, obviously, a number of those activities require collaborative working with policy experts in government, as well as the other chief professional officers within government, really just as we work in a sort of clinical environment in that sort of multidisciplinary team approach. So services aren't sort of delivered in isolation, and sort of government policy isn't thankfully delivered in isolation either. So it's that sort of partnership working within government to develop policy for our patients and ensuring that patients and the public remain at the heart of what we do. But if you indulge me for a moment, I'll tell you a little bit about healthcare science, if that's okay. So healthcare science is really the collective name for over 50 different professions. So those can really be, I guess, described in 4 broad groups. So not in any particular order, because I don't want to prioritize anyone over anyone else, but our sort of, if you think about our laboratory group, so that's anything from our biochemists, microbiologists, virologists, geneticists, and they're really our laboratory based scientific workforce. Then through to our physiological scientists, so they would be our more patient-facing scientists, and they work across lots and lots of different clinical areas such as cardiology, respiratory, vascular, and even sort of critical care as well. Our next group is medical physics and clinical engineering, and then our 4th and really our more emerging group within Scotland is data scientists and bioinformaticians. So I think you're probably kind of getting the impression it's a large and also a very diverse workforce that I represent. Now, we work across the entire patient pathway. So whilst you maybe don't see us, we work every way through from prevention, diagnostics, rehabilitation, treatment, intervention, and we're actually responsible for just over 80% of all of the diagnostics done within health and social care. But I suppose as my sort of role, it's a real incredible privilege, if I can sort of say that, to be head of profession for the scientific workforce within the NHS in Scotland, to be one of 4 across the UK holding this role. I sort of considered it a real sort of personal privilege whenever I have such an incredible workforce to provide professional leadership for.
Well, thank you. Thank you for such a brilliant overview of such a wide portfolio and vast area of work. That's brilliant. Thank you for sharing that with myself and people who are listening today. So we're here at the NHS Scotland Conference in Aberdeen. Can you tell us about how your colleagues are engaging during the event?
So really, obviously, I'll be there, and I know there's a number of my scientific colleagues from across the NHS who'll be present at the event. And really, I guess, as we all work together to build the profile of the scientific workforce within the NHS, I'd like to see in the future more science, I guess, in the programme, but I'd like to see more science everywhere. So I'm always going to say that. But of course, because there's so many cross-cutting themes within the programme, there's research, there's innovation, there's hospital at home. And actually, of course, our scientific workforce are at the forefront of a number of those pieces. So I think it'll be a really great experience, sort of where our scientists can work collaboratively and see some of the excellent work happening in some of the other professional groups as well. But of course, I think it's going to be a very exciting event this year. And I'm sure you'll agree, as most of the people I've spoken to will agree, what an incredible programme that really showcases the diversity of the professions that we have working across health and social care in Scotland.
Yeah, I completely agree. And that opportunity to network, and also with the parts of the programme and the brilliant sessions on and different keynotes, that opportunity to connect again as well and share roles and ideas. So, Catherine, the pandemic has been pretty challenging to health and social care over the last couple of years. What are the challenges and the opportunities that lie ahead for healthcare specialists in Scotland?
So I think, Tommy, we'll all agree the pandemic has probably been amongst the worst experiences that many of us have ever encountered. The impact to lives, the ongoing health impacts, and also, of course, the backlog to services. It's going to probably take us quite a long time to really fully appreciate all of that. But I am so proud of our scientists. COVID has really shone a light on the science behind health. And I don't think ever before has the public or even our other professional colleagues had such an opportunity to understand the impact that a highly skilled scientific workforce has within the NHS. If I can share with you a few things that our scientists were doing during COVID, if that's okay. And really, obviously, our COVID testing infrastructure was led by the scientific workforce. So healthcare science was really the professionals behind Scotland's ability to deliver testing at pace and testing at scale. Using their expert scientific skills, they advised government, but also they worked around the clock to ensure we had appropriate testing capacity within Scotland. But I'm going to sort of share with you, if you don't mind, a few of the other sort of maybe less seen things that our scientific workforce were doing. And our clinical engineers, and I don't know how much you know about clinical engineers, but they're really the backbone, if you like, of hospital services, both in sort of secondary care, but also in primary care as well. They ensure that all of our clinical equipment is appropriately and safely maintained. But during COVID, gosh, those professional groups, they really stood up to the challenge. So our clinical engineers worked advising government on ventilators, but also worked with the UK government in a sort of UK national group, advising on ensuring that Scotland had enough ventilators and enough intensive care equipment, infusion devices, etc. And really they were an absolutely incredible part of our workforce to ensure that we were able to provide the care to patients when we needed it in those really acute phases as well. But it'd be remiss of me not to say that our physiological scientists as well, who are our more patient-facing group, were really challenged during COVID because, of course, we couldn't have patients come into hospital for diagnostic tests in the same way as they did in the past. So they had to think very differently. So they were using their transferable skills to think, how can we deliver care to our patients at home? How can we safely advise patients to self-monitor? But all the time knowing that there was going to be a specialist scientist overseeing that remote care. And I think what we've really grasped now is the legacy of some of those really sort of innovative ways of working. And those will not be lost as we go forward. And I think certainly from speaking to scientific colleagues in the NHS, it's how we build upon some of those new ways of working and some of those innovative service delivery models and work with patients to think, well, actually, how do you want us to do your diagnostics? How do you want us to monitor you at home? Do you really want to have to come into a hospital to have all of these things done? So I think it gives us great opportunities building upon something which was really quite devastating for our country.
Well, thank you, Kathleen, for another great explanation of everything that happened. It's brilliant. I mean, I wish I've heard this when I was at school. I would have been straight to science. I would have followed the science route. You've really inspired me today. So thank you. Thank you for sharing this. Kathleen, please can I ask you, how will you be spending your time at the conference?
So I'm planning to go to as many of the sessions as I possibly can, but I think as well, this is a fantastic opportunity for us all to get together. And we've missed that over the last number of years. And I think that we miss that collaboration and that networking that we get from face-to-face events such as this. So I plan to spend as much of my time as well meeting people and networking and actually trying to sort of sense check how we can work together as we move forward as well. Because, you know, every sort of solution is best whenever we put lots of heads together and give that some great thought. So I think for me, I'm really, really keen to speak to my professions at the conference, as well as obviously seeing how we can collaborate across the different professional groups. So I think there's a lot of excitement in terms of getting in a room together and doing that sort of discussion, collaboration, and collective thinking. So yeah, looking forward to seeing people again in real life.
And if you're listening to this conversation, please pass by stand 60 and have a conversation with Catherine and other colleagues we've been interviewing over the last hours. Just finally, Catherine, what message would you like to give to colleagues listening to this interview and colleagues across Scotland?
So I think I've just converted you into becoming a healthcare scientist. So if I could do anything, I think it's really to raise the profile of just the fantastic work of scientists within health and social care in Scotland. We've a lot of work to do together to raise the profile of the significant part that they play within sort of the patient journey, across the entire patient journey that we've sort of just chatted about there. So I think it's about sort of how we can all work together and how we can really articulate the value of each of our different professional groups and the value of that collaborative working as well in a multidisciplinary team sense, to ensure that what we do is for the best of the patients and the public in Scotland.
Oh, thank you so much, Catherine. Thank you for such a brilliant conversation. And yes, you have inspired me today on the science route. And thanks to everyone for taking the time to listen. Thank you, Catherine.
Thank you, Tommy. Lovely to talk to you.